We have in the studio Dr. Joni Buechler. She's a radiation oncologist here in Watertown. And we are talking about different cancers that you see. You treat all kinds of cancer at the Cancer Center. How important is it for people to have this center close to home?
Oh, so this is huge. This is a topic that is near and dear to my heart. We live in a rural state. In the northern part of the country. So we're not only having to deal with driving a long distance, but having to drive in winter weather. So with radiation treatments, it's usually a daily treatment, Monday through Friday, anywhere from 2 to 6 or 7 weeks. So I always say one of the side effects of radiation is that, guess what? It's inconvenient. But it's a lot more convenient if you can come to Watertown, if it's closer to your home, versus driving to Fargo or driving to Sioux Falls. That not only adds an extra level of fatigue and anxiety, which I think takes its toll on people as they're fighting this fight, but we're in your community. If something happens, we're here. You're having a side effect you're concerned about, you don't have to drive 1.5 hours to have somebody take a look at it or talk to somebody about it. We are here. A lot of the people on my team, they live in this community. We are a part of this community, so we're vested. We're taking care of our neighbors. We're taking care of our relatives. This is about cancer treatment close to home. It's not, I always say, bigger is not always better. Sometimes it's just bigger. So in a facility like ours that's a little bit smaller, I think you maybe get a little bit more individualized care. People are going to recognize you. They're going to know your name. For me, I usually remember the names of the dogs and the cats, but I forget the names of the spouses. I don't know. But it is nice, I think, that it's something that we can offer to the people in this community, that they can just come to Watertown. They don't have to spend extra hours. Extra money is also an issue, and just the anxiety and stress, and we're here.
And you work with other facilities outside of here, so that is easy
Absolutely.
too.
So we get referrals. We get referrals from all over our general area. I would say probably within a 7,500 mile radius. Mm-hmm. North, we're going to Ortonville, Sisseton. We're seeing patients from there. South, probably Brookings is as far south as we draw patients. We see lots of Clark and Clear Lake patients definitely in the community.
We have Dr. Joni Buechler, a radiation oncologist with Prairie Lakes Healthcare System. We want to talk about the personalized cancer treatment that people get at your facility.
So not just at our facility, I will have to say that this is a worldwide thing, that now when we talk about personalizing cancer treatment, this is what we're talking about. We can take the tissue that you have already had removed by a biopsy. So in my world, for me, it's breast cancer or prostate cancer, those that are the ones that are most common. We send that tissue to a lab and it looks at the genetics of the tumor. Not of your 23 chromosomes, but of the tumor. And then it comes back and it gives us a risk. So when we look at patients, we say, okay, how big's the tumor? What's the grade? What does imaging show? There's different things we plug and chug to give a risk factor. Those are just numbers. Here we're taking actual tissue from your cancer, sending it for evaluation. And then it comes back, it gives us a score, and it really does guide our treatment. So I'm one of those people who I don't like to order a test if it's not going to make a difference. What's the point? Put somebody through a test. It's extra expense. We need to be good stewards of our healthcare dollar. But this is a test that can really change how I treat someone. So it makes a big difference. So for me, like I said, it's usually prostate and breast are the ones that I'm looking at. But on the medical oncology side, they are moving forward with looking at different genetic mutations, different markers, and everyone by now has heard of immunotherapy. This seems like there's new immunotherapy drugs and guidelines coming out all the time. And so, again, based on those specific tests, we can individualize the cancer care for your cancer.
Patients become family, and that's really important when you're going through something tough like this.
It is. Oh, I'm guilty. I tend to get I don't know. I take ownership of my patients. They're mine. And Even from the first visit, I'm asking questions about what do you do? Where do you live? Do you have pets? It's part of their social history, but it also helps me to get a feel for that person. And sometimes you establish relationships. Just this week, in fact, the family of one of my patients asked me to be a pallbearer and speak at her funeral. I was completely taken aback and honored by that they included me in that day. Now, I do want to say she didn't die from cancer. I treated her 8.5 years ago. That cancer never returned, and she went on to die from something else. And after the funeral, her family and her friends, they came up to me and they said, "Thank you. Thank you for giving us 8 more years with Jen." It was just very humbling. I've been invited to weddings of my patients. I've been invited to just different things. They do become friends. And you see them at Walmart, you see them at the grocery store, and they're quick to come up and give you a hug. And that is, as the commercial says, that is priceless. So.
Dr. Joni Buechler from Prairie Lakes Healthcare System, radiation oncologist, and a place that you can go close to home.